My name's Tristan Barber. I'm a consultant working in HIV medicine and sexual health in London. Also, earlier this year, I was elected to be the next chair of the British HIV Association from November. I wanted to speak to you a little bit about smoking cessation in LGBTQ+ communities. Traditionally, there's been higher rates of smoking in these communities. This can be due to a number of factors, including stigma, discrimination, mental health, and also role modelling from the community, developing norms that people want to adopt. In addition, there may have been specific marketing strategies from the tobacco industry aimed at this community in particular that may have made it easier for people to start smoking, and is one of the reasons they may find it harder to consider stopping. Historically, there has been some attitudes in this community around risk-taking because perhaps life has not felt worth living, or perhaps the risk of infections like HIV or other sexually transmitted infections has meant that smoking has not seemed top of the list in terms of issues to address. We know now that people are taking many steps to protect their sexual health. This includes pre-exposure prophylaxis to reduce the risk of HIV acquisition, and antibiotic prophylaxis, both as pre-exposure prophylaxis and post-exposure prophylaxis, to reduce the risk of bacterial sexually transmitted infections. We also know that individuals from these communities may have found it difficult to speak to their healthcare providers about issues that are important to them. This may be because they're worried about stigma or judgment. They may not feel particularly understood by healthcare providers who don't look or sound like them. Some people, in addition, may be worried about whether or not they'll be able to access culturally competent care. Like you, I know that smoking cessation is one of the best things people can do in order to improve not only their short-term health, but also their wealth, their longevity, and their overall health-related quality of life. This is why I think now it's so important that every contact by a member of the LGBTQ+ community with a healthcare provider comes with an offer of help with smoking cessation if the individual is a smoker. There are, of course, many things we can do to try and help with smoking cessation. This includes direct advice, referral to smoking cessation services, or prescribing of medicines that may help with smoking cessation. In addition, there is a smoke-free app. This is available throughout London to people who smoke tobacco. It is confidential, it provides advice on smoking cessation, it also gives prompts and reminders, and gives the user the ability to ask questions about their smoking cessation journey. Furthermore, for those who would like to access vapes to help them with smoking cessation, these are available via the app for a short time and can be delivered to the individual who is trying to quit. Please consider strong messages around smoking cessation in everyone you see who is a smoker, but particularly people who identify as coming from the LGBTQ+ community, as these people may have particular barriers to smoking cessation and may really need your empathy and understanding in helping them make a commitment to smoking cessation.